Why is a scalp biopsy needed for lupus alopecia? When it comes to hair loss caused by lupus, doctors often need to look deeper than just the surface. A scalp biopsy is a key step in understanding what's happening inside the skin and hair follicles. It helps distinguish lupus-related hair loss from other types of alopecia, like androgenetic alopecia or other scalp conditions. This is important because treatment strategies can vary depending on the exact cause. Lupus can cause inflammation in the skin and hair follicles, leading to hair loss that might look similar to other scalp issues. A scalp biopsy involves removing a small piece of skin from the affected area, usually about 4 to 6 millimeters in size. This sample is then examined under a microscope by a dermatologist or a pathologist. The goal is to identify specific signs of lupus activity, such as immune cells attacking the hair follicles or inflammation in the skin tissue. This procedure is especially useful because lupus alopecia can sometimes be confused with other forms of hair loss. For example, scarring alopecia caused by lupus can lead to permanent hair loss if the hair follicles are destroyed. A biopsy can reveal whether the inflammation is active and whether there is scarring or damage to the follicles. It can also help rule out other causes like infections or different autoimmune diseases. Doctors typically recommend a scalp biopsy when the diagnosis is uncertain or when the hair loss is persistent, unusual, or worsening despite treatment. The procedure is usually quick, taking about 15 to 30 minutes, and local anesthesia is used to numb the area. The sample is then sent to a lab for analysis, which can take several days to a week. The information gained from a scalp biopsy guides the treatment plan. If lupus activity is confirmed, doctors might adjust medications to better control the inflammation and prevent further hair loss. It also helps determine if the hair loss is reversible or if scarring has already occurred, which would mean hair loss might be permanent. In summary, a scalp biopsy is a valuable tool for diagnosing lupus-related hair loss because it provides detailed insight into the skin and follicle health. It helps ensure that the right treatment is chosen and that the underlying cause is accurately identified. If you are experiencing persistent or unusual hair loss and suspect lupus, consult with a healthcare professional or a dermatologist experienced in autoimmune skin conditions. They can evaluate whether a scalp biopsy is appropriate for your situation and help you understand the next steps for managing your symptoms.